The problem with the modern healthcare system in America is that
Healthcare in general is one of the most frustrating things that we have to deal with.
we are democratizing healthcare, which means I'm a doctor, you give me money, I give you healthcare. And that's how it works. Doctors don't get paid for sometimes 3, 4, or even 6 months. That's how long it takes for the insurance to give them their reimbursement. People, especially in rural America, they want telemedicine. They want access.
Dr. Laura Purdy, the telemedicine trailblazer. With over 10 years of experience, she's redefining healthcare by making expert care just a click away.
Accessible, compassionate, and innovative, Dr. Purdy is changing the way we experience healthcare.
So much activity is done that is outside of just that doctor-patient interaction that doctors are exhausted.
All this regulations, basically all I hear is they work against the developments.
Very corrupt, self-governing set of 50 little regulatory bodies.
If I may ask, which state is less corrupt?
Okay, so I could tell you who some of my favorites are. Shout out to
About 19% of hospital CEOs are women, despite women making up more than 76% of the healthcare workforce.
women are already at a disadvantage. There is gender discrimination. I've been sexually harassed. How did I handle that? Well, first of all,
The Avenue of the Strongest is a podcast dedicated to exploring the lives and experiences of the most inspiring individuals from around the world. Each episode features interviews with fascinating guests who share their insights and wisdom on a variety of topics, including education, impact, motivation, health, and learning. Here are your hosts, Anayet Chowdhury and Vlad Suleiman.
Dr. Purdy, it is a pleasure having you on today. Thank you so much.
well, it's a pleasure to be here. Thank you for having me.
I want to start our conversation talking about, I know telemedicine saw a massive boom during the COVID-19 pandemic. In fact, a McKinsey report showed that telehealth use increased by 38 times compared to pre-pandemic levels. However, now that we're really transitioning back into normal life, telehealth's long-term role remains a hot topic. So I'm really excited to get your thoughts about this. So now that we're moving out of the pandemic era, how do you see its role evolving in the long term? Do you think telemedicine is here to stay, or do you see in general challenges that might slow down its progress?
I love this question because people have been asking me this question since 2019, before the pandemic. Do you think telemedicine is here to stay? And I find it to be very interesting that healthcare is the one industry, and please tell me if you can think of any other industries where Americans have been wholeheartedly skeptical to introduce and accelerate the utilization of technology in the industry. I mean, from grocery shopping to dating to buying cars to banking, every industry in America has progressively utilized technology, and in no industry have we ever seen it move backwards. We didn't move to smartphones and then go back to flip phones, or move to internet and go back to whatever was before internet. We didn't move to streaming and then go back to cable TV. We always see technology evolve. And so I love this question because it allows me to put the industry of healthcare in the same progressive framework as other industries and say, yes, of course, now that we're using technology in healthcare, because that's all that telemedicine is. It's technology adoption in healthcare. No, we're not going to go backwards and stop using technology because Americans don't exhibit that behavior ever anywhere.
That's true.
Yeah, I was reading another report by CDC, and it was saying that, according to them, 46 million people, which is, big number, living in US, living in rural areas, whereas access, to healthcare is limited. And telemedicine has been positioned as a solution, I guess, especially for these areas and underserved communities. And while telemedicine can help bridge the gap between the healthcare access and for people in these areas, in rural areas and underserved areas, there's still, big hurdles like limited technologies, poor internet access, or even lack of trust in digital health solutions. And so, from your experience, what do you think are most specific strategies or innovations that could tackle these challenges?
The biggest hurdle is actually the healthcare regulators. Unfortunately, the states that have some of the most rural and most deserving and most desiring of healthcare. It's really interesting that you bring up skepticism and lack of trust, because in 2017, 18, and 19, there was a ton of lack of trust. I got asked every single day if I was a scam, if I was real, if I was a human, if I was a person. And
Mm,
that was part of the reason why we started doing so much PR on me as a person, because frankly, I was just
mm.
tired of being asked if I was real. So fast forward to now in almost 2025, people, especially in rural America, they want telemedicine. They want access. And I cannot remember the last time somebody approached me with skepticism. But the problem is that these rural places, the places that have the lowest socioeconomic status, the places that have the highest level of obesity, they also, and the worst technology, you mentioned access to actual technology, those are the places that have the most primitive, least progressive healthcare regulatory environment. And they actually seek to shut down businesses, and they seek to harm physicians and nurse practitioners and PAs, and put barriers in place to prevent them from giving access to their patients simply because they're a part of an old paradigm at the far end of the adoption curve of technology. And that is actually the biggest barrier. So what people can do, even though we're talking about state regulations, not federal regulations, so change is hard. But advocating with your medical board, with your governor, it is an election year, when you're voting, these issues actually really do matter, because if your state and the people who make the decisions for you are more progressive about telemedicine, then you and your family can have increased access to care.
Is telehealth? Is it available in all 50 states
It
or
is.
no? It
At
is,
varying
but
levels, at
at
varying
varying levels.
levels.
Okay.
So each state, which is crazy, I'm licensed in all 50 states. So you can only imagine what a headache this is. Each
Hmm.
state has its own set of rules and guidelines, which they self-create, self-interpret, and self-enforce to tell doctors, nurse practitioners, any clinicians how they can and how they cannot do telemedicine.
And it's so funny, as you said, they were thinking that you are not a real person. I think right now this is the hot question because AI and all these clones. I mean, this is really a nice question to ask. Is it a real doctor or not? I think there are going to be a lot of scams as well.
This podcast is sponsored by Argo Prep, an award-winning educational publisher serving over 1 million students nationwide. If you're a kindergarten to 8th grade teacher or principal, be sure to check out our supplementary workbooks to get your students ready for standardized state testing. We cover all subjects from kindergarten to 8th grade. Use the coupon code AVENUE for a 25% discount off of all purchase orders. Visit us today at argoprep.com/store.
I have another topic here in another report about the physician burnout. So this is a major question nowadays, of course, especially after the pandemic. And Medscape in 2023 report found that 53% of doctors say they're burned out. And one of the key drivers actually is the over administrative tasks and long hours. And you've spoken about how telemedicine helped you avoid burnout. Could you please share your experience? How did you manage all this work-life balance, especially as a mother of four?
Well, here's the thing. The problem with the modern healthcare system in America is that insurance companies, administrations, and health systems put so many checkboxes or hurdles from the time you see the patient to the time you're administratively finished with that patient, that the doctors spend way more time on documentation, compliance, attending classes, just for compliance sake. So much activity is done that is outside of just that doctor-patient interaction, that doctors are exhausted. And a huge part of the reason why I said I'm going to leave mainstream healthcare and do full-time telemedicine is because when I was working as a hospitalist, when I was doing 12-hour shifts, it's miserable. I mean, leaving before the kids wake up, getting home right
Yeah.
before they go to bed, getting nothing accomplished. In a 12-hour shift, you get
Yeah.
that day is gone. You can't do anything, right? And so for me, I think I fall into the more modern progressive worker where I like work from home. I like digital nomad work. I like the freedom to be able to work where it fits in my life and not try to fit in my life around my work.
I'd like to understand just how far you can take telemedicine. So when you see patients, and I know 'cause we just mentioned this, that it differs from state to state. So we'll just focus on like Florida, for example, because you live there. Can you kind of walk us through? So are you able to? Are doctors who are doing telemedicine, are they able to prescribe things to patients? I'm trying to understand what kind of, like, who is telemedicine for? Like, if you're feeling sick, I suppose that's an easy option. How about for people with chronic diseases? So I'm just trying to understand the scope of the patients that are able to use the service.
Well, almost anybody can use telemedicine. So the beautiful thing about the digital health tech industry in America is that there's a wide range of technologies that allow you to provide a wide range of services to patients.
Hmm.
There are things like remote patient monitoring. There are diagnostic tests like at-home lab kits. And there's radiology and imaging studies that you can get. There's specialist consultations. Almost every subspecialty, even the surgical ones now, are finding
Wow.
some way. I mean, obviously you can't do that. You can do surgery. You can't deliver babies over telemedicine,
Right.
but 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 you can still
Not yet.
have follow-up visits or consultations. There's a lot you can do. I mean, I had virtual OB visits during the pandemic, and that was considered okay because I was pregnant then. So the answer is what you can do over telemedicine and who is it for extends as far as the technology will safely allow it to be able to go. So as far as the technology can take you and as far as you can be within the bounds of the law, obviously. Here's another good example. Some hospitals are doing virtual inpatient now, where the doctors do their rounding virtually, but the nursing staff and the nurse practitioners and people are on site with on-call surgeons and emergency people available to come in. So who it's not for, emergencies, true emergencies, people
Hmm.
who could potentially be having an emergency. Like if you have abdominal pain, I cannot tell you over telemedicine what is going on with your abdominal pain. If you're having chest pain, same thing. If you have a head injury or broken arm, I can't help you. But if you need intervention, or obviously, like I said, having a baby, right? If you physically need a doctor to put hands on you to either figure out what's wrong with you or help you get better, then that is where the line is drawn to say this is not for telemedicine.
I wanted to mention we spoke about the if you're doing the surgery, you can do it remotely. Actually, in China, they made the first heart surgery, I believe, or something, where doctor was 1,000 or 2,000 miles away. I mean, of course, he was in another clinic, and the patient was also in the clinic, so he was doing remotely heart or some crazy surgery remotely with a robot.
I'm not
And it,
surprised to hear that because technically they do that right now. When you're doing
Yeah.
a robotic surgery, the doctor's over there and the robot's over there. You're just in the room, right? So I won't be surprised if someday we do see that. But right now, as it stands in the US, the telemedicine laws and the state regulators would not, I don't think they would ever allow a surgeon to be practicing
Mm.
medicine in another facility through surgery.
I want to talk a little bit on women in leadership and healthcare innovation. According to a 2022 Harvard Business Review article, about 19% of hospital CEOs are women, despite women making up more than 76% of the healthcare workforce. There's obviously a clear gap in leadership representation, especially at the highest levels. You are a successful female entrepreneur in healthcare, having co founded telehealth companies, and you've led initiatives in digital health. I want to ask, what are some of the unique challenges you faced as a woman in healthcare leadership, and how did you overcome them?
Well, I think I've faced the entire gamut of challenge. I mean, you name it. If you could dream of a woman having a challenge in leadership, I've been sexually harassed. I remember one time
Mm,
a very, very rich, mega multi-billionaire of a company who shall not be named actually called me sweetheart, complimented my body, and then refused to talk to me and would only talk to my male CEO when I was a chief medical officer, which is a pretty high
wow.
ranking executive, at one of the largest telemedicine conferences in the United States. You know what I
Wow.
did? How did I handle that? Well, first of all, I let him know that he was being inappropriate. Second of all, I let my executive team know that they were being inappropriate for not only not having my back, but also continuing to move forward with him because his billions of dollars were more attractive than their ethics, I
Mm,
guess. And then
yeah.
third, I ultimately left the company. I don't have time for that nonsense. This is 2024. Like, I don't need to be
Yeah.
sexually harassed in the workplace, you know?
I love that, and thank you for sharing that. I mean, it's
Sure.
unfortunate, but these stories are very important, and I'm really really looking forward to see. I mean, we're on the right path, but I mean, we all have some work left to go before we get there. So that's a great follow up to my next question, which is there's obviously still a lack of women in executive healthcare roles. What advice would you give to other women aspiring to take on leadership roles in this industry?
Oh wow, that's a great question. First I would say is don't make it a competition, right? It's really in vogue right now for women to on social media and things like that say, oh, we need to support each other. We need to not compete with each other and not be at each other's throats. There is a lot of truth to that. And especially in healthcare, there is no reason why women leaders need to be competing with each other. I mean, a little healthy competition is fine, but doing things to undermine your peers or talking bad about them behind their back or gossiping about them or making them look like they're in a negative light, this catty mean girl bully nonsense drama doesn't belong anywhere, but it definitely doesn't belong in the healthcare workplace when, as you just pointed out, women are already at a disadvantage. There is gender discrimination. I actually identify as a healthcare administrator. If somebody asks me, like, what do I do? I don't say I'm a doctor. I might say I'm a startup founder, but I don't say I'm a doctor
Hmm.
anymore. If they say, what do you do in healthcare? I say I'm a healthcare administrator. I consider myself to be equal with the hospital CEO, although we have different skill sets and
Mm,
we have different things that we're good at. I manage a nationwide company with hundreds of clients all over the country. How is that any
right.
different than being a hospital CEO, managing departments? So, lack of competition, supporting each other, building each other up, giving each other opportunities if you feel like you deserve it. I think those are some of the ways that women can advocate for each other to help give each other an advantage because nobody else is going to give it to us, right? We really have to help each other.
No, that's really good advice. I love that.
I want to talk about um, the telemedicine. Is it from the pricing standpoint of view? Is it obviously this is the patients and all this, but is it cheaper?
Well, the answer is it depends. It depends because if you have amazing insurance and you don't have to pay anything, then yeah, it's cheaper than paying nothing, right? But you've heard the rule of you can have something fast, cheap, and good, but you can't have all three, right? So if it's cheap, it may not be fast, but it could be good. And the inverse of that is true. A lot of telemedicine programs seek to be accessible and inexpensive. But a lot of telemedicine programs also provide services that insurance won't cover, for example, medical weight loss. People are doing so much medical weight loss because insurance is still very hesitant to pay for it. And so, yes, in that instance, telemedicine is cheaper because you can pay $1,000 a month or you can pay $200 a month, and that's a lot cheaper.
Okay, now let's talk about the technology because this is one of the topics nowadays, and technology has the power, of course, to reshape the healthcare. And we are seeing innovations like AI, remote patients monitoring, and virtual consultation taking center stage. And there is a report by Deloitte. We have so much reports today, saying that the global telemedicine market is expected to reach $185 billion by 2026. And this growth presents massive opportunities, but also challenges. Somebody deeply involved in healthcare innovation, what role do you think emerging technologies like AI and remote patients will play in improving telemedicine and patients' outcomes?
Well, emerging technology will always play a role in every industry, and healthcare is no different. But the difference in this industry is that the regulations have to catch up to the technology to make it legal. Usually, what happens is technology comes out, people try to use it, regulators find out, they get mad, impose sanctions, make laws. We have to take a few steps backwards. It's really, we're chasing our tail with the regulators and the technology. But if you look at everything 10, 20 years from now, AI and emerging technologies are going to be deeply embedded and ingrained into the way we think about practicing medicine, just like they will be in virtually any other industry.
Why do you think all this regulations, basically all I hear is they work against the developments, the progress?
Corruption. I mean, I have gone face to face with almost every single one of the 50 state medical boards, and they know me and I know them, and there are good ones and there are corrupt ones. The states that are not corrupt do not impair progress, and the states that are corrupt very much do. And so that's why I think it's important advocacy. I mean, medical board regulators are voluntary or paid positions. They're not elected. They're appointed by the governor. They can be removed for people calling out their corruption. They have a duty and an ethical responsibility to the public. But the problem is nobody really knows and nobody really cares and nobody really understands that they could advocate to have them removed and replaced with people who have better ethics. But it's a very corrupt, self-governing set of 50 little regulatory bodies.
If I may ask, which state is less corrupt?
Okay, so I could tell you who some of my favorites are. Shout out to Arkansas. Shout out to, let's see, Alabama is great. Who else do we love? Nebraska, Nevada, Alaska, Montana. There's a lot of states that are really good, actually. I don't want to leave anybody out. Who else are my favorite Florida. I forgot about Florida. Florida is amazing. Florida, I think, is one of the Florida and Nevada may be tied for two of the most progressive medical boards. And California is right behind them, but they are very contentious. They're progressive, but they're contentious. They get a lot of people in trouble for a lot of things, and some of it may be a little unnecessary. So I can't put California at the top of my list, although I would like to, but I think Florida and Nevada are two of the best.
How optimistic are you for the future of telemedicine? Because I think it's going to be, well, I have no idea about this industry, so I don't know actually why I'm giving you my insight. So let me stop before I make a fool out of myself. So is it an optimistic view?
Well, I don't really think about the future of telemedicine because telemedicine is just a tool. It is also an industry. Right. It's an industry, but it is a tool and it's an industry. I say digital health tech industry because I think it's way more than just phone, video, and chats than it used to be. But the state of healthcare as a whole, oh man, the future is so bright because I'm one of thousands of founders out there who are incubating their little ideas and they're getting their VC money and they're making their little technology and they're attacking their piece of the pie, and some of them are going to make it and some of them aren't. Some of them are going to get acquired. And I really like that when it happens because when big companies or big systems acquire these little services, that's the institution being willing to get better and to grow and to progress. So healthcare is only going to get better. I know what people say. I know what people think. And I'm talking about, 20, 30 years from now, healthcare is only going to get better.
That's amazing. Well, I'm optimistic for the future as well. But I want to talk. So this is actually, I'm really interested in talking about this next topic over here, which is creating a cash pay model. Now, your model of a cash pay system for healthcare where patients don't have to rely on insurance or government aid is an interesting concept, especially as more people are talking about transparency and the rising costs of healthcare. I kind of want to talk this, and I love this, by the way. How has your cash pay, no insurance model transformed the way that patients seek care, and do you see this becoming a larger trend in healthcare?
Yes. So the term is, you can say democratized. So democratized healthcare, which is healthcare is a democracy. Now, I just told you that the regulators are in the way. And so, yes, there's a little bit of an oligarchy above the democracy, right? We do have some overlords, but we're gonna be optimistic in the way we talk about it. And I'm gonna say we are democratizing healthcare, which means you have your hard-earned American dollars, right? And your hard-earned American freedom of choice, and you got money, you want healthcare. I'm a doctor, you give me money, I give you healthcare. And that's how it works, right? And I don't mean to sound like a mob boss taking a bribe. I mean, it's just like going to the grocery store, right?
Right.
You give me money, I give you groceries. And imagine how simple that is. I mean, what is it right now? You go to doctor takes insurance card, says, ooh, copay. Then you see the doctor for some unknown amount of money.
Yep.
Then you get a bill. Several weeks later, you're going, what is this for? Because you forgot about the visit you had 6 weeks ago. And it might have a totally different name on the bill from the place you went to. And it's for some additional unknown charge that you weren't expecting because your insurance company didn't pay for it anyways. And oh, by the way, you did already have to pay for your medication or your lab or whatever. This is the most fragmented, ridiculous payment system, and it leads to frustration and a lot of stress for patients. But did you know it also leads to a lot of stress for doctors because doctors don't get paid for sometimes 3, 4, or even 6 months after they see their patient because that's how long it takes for the insurance to give them their reimbursement. Yes. And if you don't code it right, if you haven't documented everything correctly, the insurance company might not decide to pay you as much as you charge. And if they audit you, they might take some of it back or accuse you of fraud, which happens all the time. So like I'm cash pay and I still get investigated for fraud sometimes. And then they realize, oh, you're not using insurance. And I'm like, no, this is all cash pay. And then they go away. Insurance is a frustrating system for everyone. And cash pay makes things so much more simple, especially for lower acuity stuff. Like we're not doing cash pay trauma surgery. Like I said, we're not doing cash pay appendix removals or brain surgery. We're not doing cash pay like that. But for simple things that you might go see your PCP for, a lot of people would rather pay cash for that than to pay monthly into some sort of a insurance premium.
And it's cheaper when you take away from the insurance companies. It's much cheaper.
Correct.
Yeah, I can't begin. I think I speak for most Americans, but yeah, healthcare insurance is one of the most, or healthcare in general is one of the most frustrating things that we have to deal with. It is really crazy because you never know how much you're going to get billed when you get. It's funny because my wife, she went to urgent care a couple of months ago, I think, for something silly, but nonetheless, she ran it through her insurance. The front desk guy told her, hey, if you pay out of pocket, it would be, I think it was like $150. But because she had insurance, I think legally they have to run your insurance and so on and so forth. And nothing about prices, it's just, okay, they saw her. She was out 5 minutes later. And then a couple of weeks later, she gets a bill with a weird code and all this kind of stuff that makes no sense. And now she has to pay, or she paid like $375. It's extremely frustrating. There's a lot of Americans that enroll in HSA plans. So for those listeners who don't know what HSA are, it's a health savings act. You can, save your pre-tax dollars, your hard dollars. And it's actually an incredible investment tool because if you're a family, you can, I think, stash away, I think, $8,200 for the year. But again, so for me, I use that as an investment purpose. But when I go to the doctor, I don't, because it's a high deductible plan that I have to enroll in. What if I get a bill for $2,000, $3,000? I don't know. I can't ever just walk in and say, hey, can you please tell me how much this is going to cost me exactly? I mean, it's just so frustrating. It's a guessing game. I would love transparency. I want to go in just like before I decide to buy a banana for 25 cents. That would be great.
Isn't
Shouldn't
at
have to
some
be that
point
hard.
insurance was a mandate that to have it, or it still is? I even don't know.
No, under Obamacare it was mandated, or else, and you got penalized on your on your taxes
Yeah.
when you file. But now you don't have to have insurance. But I mean that and I suppose that's a risk as well.
It is.
So many insurances in life, right?
Yep.
So many insurances in life.
We need to open up
Well,
an insurance company.
did you know? I learned that insurance companies, they're an insurance company insuring, let's just say homes or for floodings and stuff, but the insurance companies themselves have an insurance policy on themselves. It's just
No,
bizarre. I mean, I don't
I
understand.
didn't know
Yeah,
that.
I just read that a couple days ago. It just makes my head hurt, honestly. Well, Dr. Purdy, it's been a wonderful conversation with you talking about telemedicine and health. We have a tradition on this podcast where we ask a question from a question that was asked by the previous guest, and then I'll let you ask any question you'd like to our future guests that we have on. This question is from our last guest was, what is one trait about you that has made you successful, that that you're successful because of this? What is that trait?
That trait would be resilience. I was recently told by someone who I hired as a consultant to help me do some growth and branding that I'm resilience personified. And I've had a tremendous amount of opposition. I mean, you name it, I've faced it. And the ability to not give up, even though I have felt like I wanted to and maybe needed to a few times, to not be defeated and to continue being resilient, that has been the thing that has really driven me forward.
How did you become resilient? Where do you get that from?
Couldn't tell you. I
Really?
don't think it's
Okay.
something you can teach. I don't think, I
Yeah.
mean, look, I grew up in poor, rural, southern Kentucky with
Right.
hardly no advantages given to me and certainly nobody helping me out anywhere. And I don't know, my mom would probably say I was born that way and they did the best they could.
I mean,
But I don't
here is
know.
your answer.
That
Here
is,
is your
yeah.
answer. This is what made you resilient. You made you made your way up. Nothing was given to you. So this is one of the
Nothing. In fact, a lot of things were taken away from me and a lot of people tried to push me back. They still
Mm.
do. That's actually actively happening right now.
Wow.
And, I just kind of tell them what I think of that and move on.
This is what we need to do with our kids. Not to give everything so they can be resilient as well when they grow up.
Yeah,
True.
resilience is a critical trait to have. Yeah, it's hard to teach. Yeah, it can't be. It's something that cannot be taught. It has to be just something inside you, whether it's from childhood experience or a past experience or something like that. Dr. Purdy, what is, and you can ask any question you'd like, what is the question that you would like us to ask our next guest?
Are they usually like business owners or what type of?
Every guest is in different industries, so but any question will go. Please, you don't have
Okay.
to hold back. Yeah.
So, okay, let's do this. If you could wave a magic wand and change one thing about your life right now, whether it's personal, professional, relational, the color of your hair, I don't care. If you could wave a magic wand and change one thing about your life right now, what would it be?
I love that question. Dr. Purdy, please let our guests know where they can find you, what kind of fun projects you have going on. Please let us know, because I know you are a startup founder as one of your titles as well. So please tell us a little bit more about that and share any information you can with us.
Let me tell you what's the most exciting thing to me right now, and it's the funnest thing I've ever done in my whole life, is so Swell Medical PC, swellcare.health is our primary company. That's the name of our medical group. But we just launched a brand for music festival and event goers, and it's called JellyMed. So the thing we didn't talk about was my first career was actually a performance musician, and I walked away from that due to opposition. And we're bringing it full circle. So we've already got to meet some world famous performing artists. We've already got a lot of buy-in from a lot of key stakeholders in the industry. And guess what? We have zero competition, and the ocean is as blue as it could possibly be. And next month, in exactly 4 weeks, we're going to be the official healthcare sponsor of Dusk Music Festival. Cascade is the headliner. It's a huge deal. And all we had to do was see a gap in care that festival goers have nobody who's paying attention to their healthcare. All they are is stigmatized, marginalized, and judged. And so it's a brand built on our telemedicine company. We're going to have boxes, so OTC rave recovery boxes, OTC or prescription rave recovery boxes, and a sex box because we know what sells. So we've compounded a clitoral stimulation gel. We've got morning after pills and STI prevention and a cute little stuffed animal jellyfish and lots of merch and swag. So it's called JellyMed. You should check it out. It's powered by Swell Medical because everything we do goes back to telemedicine,
Right.
telemedicine visits, but it's really a wellness, awareness, and PSA company, and it's at High JellyMed. It's the funnest thing I've ever done. You should check it out.
That's incredible. I will go ahead and check it out. And I do. I want to bring back because I know you mentioned about you being a musician, or I do remember that you played the piano, or what was it?
I do.
But
yeah.
I'm pointing out specifically because you said you faced opposition there. What I know we were supposed to end, but I really want to hear this because I'm not going to feel great if I don't hear the story. How did you face opposition in that? Because you played this was like professional level, right?
I was a professional accompanist. So I am not a person who loves the spotlight. I never have been, and I always love to share success with others. So I was never a concert pianist. I was a professional accompanist. And once upon a time, over 20 years ago, there was a 17 and 18-year-old me who was the professional accompanist for a professional company in Indianapolis. And I have to be careful how I talk about it because this person who drove me into healthcare is a public figure out of Los Angeles.
Oh, wow.
And she is a very well-known person, and I run into her from time to time. And I don't think she knows who I am because she was an adult then, and I was very much a child.
Okay.
So, and my name has changed, right? So,
Okay.
but I had been contracted with this company for 2 years. I did a lot of work actually with her mother. I worked with children's musical theater because I was a professional accompanist, and they had hired me to be the accompanist for this company, this performance company is what I mean. So we had flown in adult. I keep saying adult because I was a child. I was 17. Right. I was a minor and a kid, right? Yeah. I was a kid. So, but I was a prodigy at piano. I was so good. Everybody hired me to do the work, and I did not understand how awful people can be yet. I was not very wise to the ways of the world. So
right.
I went on a student exchange trip, and I found a kid, somebody who was my age at another school, and asked him to cover for me while I went overseas to do a student exchange. So went overseas, came back, resumed my job. Well, when it was time in the fall for the show to happen, they had flown in this public figure who will not be named, had flown in a professional production company, partially from New York and partially from LA, with Broadway actors, Broadway singers, a professional director, producer, production crew, lighting, sound. I was so excited. I got to actually rehearse with these Broadway actors. It was unbelievable. But when it came time for the show, I actually walked out into the orchestra pit, and the lights were up and the curtain was up, and that guy that I had hired to cover for me when I had been gone for the summer showed up. And my music was gone. And he took my music, and he actually played the show and stole it from me in real time. And I had friends and family in the audience, and he acted like he didn't know what he was doing. And I really had no idea what was going on, but I was humiliated. And come to find out, she who shall not be named and the guy who I had hired to work for me had connived behind my back. And he wanted to take it from me. And he said, she's not going to do well. She can't hold up under pressure. She can't do it. You want me to do this, even though I had worked with her for 2 years and had,
right.
And I was an excellent performer. Okay. I did not make mistakes, and I hold up very well under pressure. So take that for what it's worth. But she believed him. They schemed behind my back, took it away from me in real time. And I never got paid for that ever.
Wow.
She actually ended up committing some fraud, stealing some money, has a mugshot online, and did get arrested, but then went to California and now is a famous celebrity fitness trainer.
Wow. Well, I'm sorry to hear that.
And so I went home and I said, I quit. I cried all day.
Yeah.
But I quit. I'm out. If this is what music is, I don't want it. I canceled my music school auditions. And my dad said, why don't you go be a nurse? And I said, fine. Oh, go be a nurse, which eventually changed to doctor. And here we are.
Yeah.
You know what I always say, whatever happens best. Maybe it was meant to happen. Maybe this is also was a contribution to you, and this is where you. So you never know.
Yes. Yeah. Some people would say that's bullshit, but I generally agree with that statement, Vlad. I think whatever happens does happen for the best, and that's
You just realize what's best years later, maybe not at that moment, but years later.
Yeah. Well, listen,
and it's coming full circle, right? Yeah. It's coming full circle right now. Look what we can do. Look what we're able to do. I will perform again someday. Those skills don't die. But now I get to be a doctor and be a startup founder and bring healthcare to ravers, which are some of the coolest kinds of people.
No, that's very cool, and we wish you a very exciting journey. You know, we've been running companies also for 10 years now. It is the best thing. It's the most fun thing. It's the most stressful thing. It's the most, you name it. You know, we've been through the same things, all the ups and downs. But at the end of the day, I mean, I'd rather do nothing else. I mean, this is our passion, and I'm sure this is your passion as well. So thank you for all the amazing work that you do. I had a great conversation with you, and we look forward to maybe reconnecting in a year or two and seeing where you are, and we'll catch up.
Anytime. Thanks for having me, guys.
Thank you so much.